The current public response of this being the most medically accurate show starts with John Wells, Noah Wiley, Scott Gemmell. They created and cultivated a culture where it was absolutely imperative to get it right and to show it as accurate and as authentic and as messy as possible. I'm Lizzie Ferreira. I'm an emergency medicine physician, and I'm one of the medical consultants on the Pitt.
170 over 92 at triage.
324 chewable aspirin sublingual nitro Q5 times 3.
Cath lab is standing by and ready.
Harvey, if we get you up to cardiology, they can open your blocked artery. We can stop this heart attack.
My job is to design the organized chaos that is the emergency department. Joe Sachs, one of the head writers, co-executive producer, he created these scenes with the writers in the room that then trickled down to us, the medical consultants, to try to bring about that seriousness and the authenticity into how we shot. When we were working through a scene with both the director and the cinematographer, verbalizing what we're anticipating the actresses or actors to do in that moment on what cued line allows the DP to plan her shots and do her blocking, so that way those very sensitive moments or, emotional moments can be captured with the action of the medicine at the same time.
These pulses, we clear, and then shock. I go first, you hit it as fast as you can.
I got it.
How we consult with the actors, which is a major part of my role on set, is really the rehearsal and the education and teaching them the finesse and the refined movements, because at this point, for a medical professional, it's reflexive in order to put on a cast, place an IV, intubate. And so to watch them practice over and over again to create those natural movements, so that way when they're saying the words that they need to say to get the emotion, they're not fumbling across, not looking like they know what they do.
How long will you live without the oxygen?
It's difficult to say.
The scene that I think stuck most to real life would have been this scene in episode 4, written by Noah Wiley, where there's an older gentleman who's passing away from multifocal pneumonia and sepsis. And the process that kind of starts from episode 1 all the way through episode 4, where you see a family member not being able to give up on that person, and you see the struggle of what intubation looks like. The general audience learns what intubation looks like, and then going through the process of transitioning to comfort care to allow there to be dignity in death is actually one of the most common conversations we have, both in the emergency medicine setting, in the hospital, and in critical care unit. And I think it's actually a really great educational moment to let people see that sometimes there is dignity in death. It's a bit disturbing, but it gets all of it in one beautiful moment.
Your labs and your brain scan are all normal.
So then what's wrong with me?
We're having a psychiatrist come talk with you.
You think I'm crazy?
A psychiatric illness could just be
I'm
causing
not
your
crazy.
symptoms.
You have to believe me.
I think this gives credit to the creation of Dr. Mohan's character regarding seeing this patient with mercury poisoning and maybe kind of being slighted off as just having a new psychotic break, because her characteristics and her demographics might have matched something with mental health disease. I think it speaks to the creation of the character in such that she doesn't really give up because it doesn't make sense.
Take me through your skincare routine. Don't leave anything out. Write this down.
And her continuous probing, despite being called slow-mo, ends up saving this patient a psychiatric hospital stay and maybe a complete disregard for the fact that this was more of a toxicity instead of an actual psychotic breakthrough.
I'm thinking this is a toxicology case.
Everything is pointing to new onset schizophrenia. So what zebra are you hunting?
She's been using a face cream from Asia with a high mercury content. This could explain all her symptoms.
Mercury poisoning is, I wouldn't say rare, but not as common. We do see a lot of toxicities from various household chemicals, various makeup products, or just exposures to general environmental things quite often.
Don't touch me. I'm fine.
Jesus fucking Christ.
It's okay.
I think the inspiration behind showing Dana get punched is, one, there is an actual level of violence in the emergency department. I never call the ER a glamorous place. And it's because we're seeing all walks of life. We do not discriminate. So whether it's patients who are unfortunately under the influence of various drugs, if they have underlying psychiatric disorders, if they've gone through a very traumatic moment and coping mechanisms are not in place for them to tolerate any bad news, sometimes it can be projected onto the healthcare worker who is either providing the bad news or somehow the system is failing the healthcare worker, which then fails the patient. And Dana is the perfect character to have this happen to, because you see someone who's been trying the entire season to move the department along, to get patients seen, to try her best to take care of not just the patients, but her staff, and acts as this mama bear to everyone. And so to see someone kind of on this pedestal get assaulted, which is completely undeserved, I think brings some realization that this is much more of a serious issue facing healthcare workers than was previously acknowledged. Because we can say it, but until you see it, sometimes you don't believe it.
Tell me a little bit more about your pain. Can you give me a number from 1 to 10, 10 being the worst?
It was like a 2 the first few weeks. Then it went up to a 5. Now it's worse, like a 7.
How the doctors differentiate care to minors, the writers were really the most important people in this, because the choice of words allows the actors to deliver the message in a very kind and comfortable way that doesn't make children feel scared, because the ER is a very scary place.
Jay, we're going to check below the waist. You'll be all covered up. Would you like Dad to stay?
Yes, please. Don't go.
Okay, I'm here.
Specifically with a very sensitive scene of the imperforate hymen, where it's Dr. Mohan and Dr. Mel who have to go ahead and do a very sensitive exam on this girl. Within our roles as the medical consultants on the show, explaining to them the necessity of discussing slowly where you're touching so that the child or the teenager is very aware, and then showing those movements very gently in a way that doesn't expose the actress, but also shows how invasive this can be and how they try their best to bring about modesty to the patient.
Sorry, the ER can be very noisy.
I agree.
That's Terrence, the autistic patient who comes in, who is a phenomenal actor. Breaks are very common. I think I splint something on average once or twice within a shift. We call them bread and butter things that we deal with in the ER. And the approach in the scene between Mel and Langdon, and Mel's approach to Terrence and his ankle sprain, really just demonstrates the need to be able to build rapport and understand your patient's personality and needs quickly so that you can build that trust.
Teddy, 28 years old, burned in a gas tank explosion. Paramedics estimate 90% BSA.
Regarding the scene of Teddy, our severely burned victim who ends up, getting intubated in an escharotomy and gets admitted, you think there's hope, because you're kind of seeing it through the point of view of Whitaker and the wife. And Whitaker, who is an MS4, a fourth-year medical student, we have a lot of hope in medical school. And medicine kind of teaches us the true prognostics of our patients and what the actual realities of their likelihood to survive is, based on experience studies, all these things that we end up garnering in ourselves. And so at the end, when he passes off and you see Langdon talking to Whitaker and mentioning to him, don't give the wife too many hopes. This guy's got the highest mortality rate. He's most likely not going to make it out of here. You kind of see the innocence kind of removed from Whitaker, that people are just going to keep dying no matter what I try. We always want in our films and in our movies, for the most part, to have a happy ending. And this wasn't that. And this was kind of the development and realization with Whitaker at the same time that moment wasn't going to happen and he wasn't going to receive that.
Hi, I'm Dr. King.
Buster Pirelli.
I take it you're a children's entertainer?
Impressive observational skills.
To have Whitaker drill the IO into an awake patient fully talking was one of the most hilarious scenes.
Okay, you're gonna feel a little pinprick here.
Ah! Fuck me!
No, it should not happen ever. Has it happened? Maybe, not with my personal experience anecdotally. The major point that we wanted to get across to the actor who plays the clown was he's drilling directly into your bone and you are awake and it's almost torture. And so what he brings across to the screen and everyone else's shock and slight horror, I think was captured perfectly.
Mr. Puglisi, have a seat and the triage nurse will call you back soon.
Thank you.
Unfortunately, the healthcare system right now is a bit overwhelmed, overcrowded. There's lots of risks to patients. The wait times are long. There's not enough nursing staffing. All of that is accurate. I work in an emergency department. On average, we have 40 patients waiting several hours to be seen by an emergency medicine specialist in the ER. John Wells, Scott Gemmell, and the team really wanted to show the waiting room build up between episodes. That chaos, despite their attempts at organization, is really how some ERs feel in the modern day era. And it's one of the most difficult things for us to try to approach because it's so multifactorial with how the hospital is staffed that causes these unfortunate patient outcomes just because there's no space or there's not enough staff. You know, a patient ends up seizing at the end, I believe, of episode 4 due to the wait time while Driscoll, the guy who ends up punching Dana, is there saying, like, are you kidding me? People hearing that it's the most medically accurate show can take it to heart when they're waiting now. I've had patients come in and say, oh, no, it's not a problem. We know it's really busy. It's been a big difference in how I've seen emergency medicine slightly shift with those who may have seen the show.